Oh, no.
Welcome to our final session of the Special Education and Pupil Services Leadership Academy for the 25-26 school year. Happy May, everyone. This academy is brought to you by partnerships between the Wisconsin Regional Special Education Network, or the RSN, the Wisconsin Department of Public Instruction, or DPI, and the Wisconsin Council of Administrators of Special Services, or WCAS. My name is Rachel Kotarabik, the Regional Special Education Network Director for CISA 7. We're excited to have so many of you join us, and I continue to hear the doorbell ring, so people are continuing to come into the meeting. Our team strives to be inclusive and meet the needs of all of our Wisconsin directors. The intent of these sessions is to provide you with timely and relevant information so you can do your important work in all of the school districts across our state. Some of our meeting expectations, as you can see on the screen, we invite you to turn your camera on if you are able, but with this, we ask that you are mindful of your space and surroundings. Please mute your microphone unless you are asking a question. We ask that you use the parking lot document for questions that is attached to the agenda and also will be dropped in the chat for you. Also, please use the chat to respond as prompted by any of our guest speakers, but please keep that chat also focused on conversations that benefit the group. We would like to remind you that we have a participant folder for resources that we will update each month. This is linked in your agenda, and in addition, there will be a follow-up email that comes to you after the session with an agenda that is updated and speaker slides and timestamps with our recording. As I mentioned, we do utilize that parking lot, and any unanswered questions in this document, we will work on providing a response to. Please include your contact information if you prefer, and if we are unable to get to any parking lot questions during our session today, we do continue to monitor that document and respond accordingly. If you have a question for one of the experts speaking this morning, we're happy to facilitate getting the question to them and respond on that response posted in the parking lot document. Again, the agenda should be in the chat. Each month, we do encourage you to set a goal for yourself for the session. By setting an intention for your learning, we are able to better focus energy and attention on the pieces of information most applicable to our work, and then more likely to take that information back to the districts in which we work. We do have a full agenda for you this morning, and first up, we'll be joined by Andrea Donegan, who will be talking about suicide prevention laws, model notice, and resources. Then we'll be joined by Carrie Wilson-Smith, who will share about DPI phone support data. Following that, we'll take a short break, and after our break, we'll be joined by the Department of Health Services for a presentation on school-based services mandatory compliance, and then we'll wrap up our day with a short summary of high leverage practices. So just a lot going on. As you can see, here's just a screenshot of our agenda for today. So I hope everyone has had an opportunity to identify a learning objective or set an intention for their learning this morning, is sitting with a full cup of coffee or beverage of choice, and we are going to go ahead and get started. Welcome, Andrea.
Good morning, everyone. Again, Andrea Donegan, School Counseling Consultant on the Student Services team at DPI, and I am the Suicide Prevention Content Lead. I also support a number of other initiatives, including our social emotional learning, our K-12 school counseling programs, career readiness, homebound instruction, military child, and support the comprehensive school mental health framework as well. So today, as mentioned, I'm going to share about the suicide prevention laws. Some of them you may be familiar with. Some of them it's just a good reminder. I also will be providing resources. I will share the PowerPoint presentation to be shared all with you following the presentation. So know that that will be coming and is available to you as well. So is it okay if I now share my slide deck? Okay, perfect. So all right, can everyone see that presentation? I'll put it in slideshow mode. All right. All right, so again, suicide prevention statutes and resources. And please feel free, again, to drop any questions into the chat as you think of them, and I'll be happy to answer them. I'll also provide my contact information at the end so that you can reach out to me directly if you think of questions later as well. So I always like to start our suicide prevention presentations and trainings with just a call out and a reminder to all of you to take care of yourself. We come to this work from all different perspectives and experiences, and some of those are recent and some of those are past. And so do what you need to during this space and afterwards to take care of yourself, whether that's stepping in or stepping out, or taking a pause and doing what you need to take care of your mental health and well-being. The 988 number is listed here, and it's, again, a reminder that this is not only for us to share out with our staff and with our students and our families, but also to utilize ourselves as we need to when that comes up. Data, we all know the data, so I won't spend a lot of time on this, but I think it just is important to remember some of this, the reason for the state statutes that we have and the resources that are provided, with suicide being the second leading cause of death among youth aged 10 to 14 in the US, and third among people ages 15 to 24. And that is certainly the population that we serve. The YRBS data for 2023 is linked here. If your school district participates, you have access to that. The 2025 results are not out. I know I've gotten a couple calls about that, and our YRBS team, which you can find their contact information on the website, which I believe will be linked here in the slide, can give you more information of updates about when that will hopefully be coming out. It's a matter of waiting for the data to trickle down from the federal level to us. So don't have a lot of control over that, but we certainly try to get it turned around as quickly as we can when it comes our way. The other thing that I'll call out is that there's county level data. So if your school or your district does not participate in the YRBS, encourage you to look into that. And at the same time, there is county level data that might be helpful in terms of just knowing what's happening in your geographical area with schools and communities that might be more similar to you than maybe that state look or that national look. So that is linked here as well, so you can reference it. So the results from the YRBS 2023, students who participated in this, who seriously considered attempting suicide, that was almost approaching 20%. So when we think about, classroom, 1 out of 5 students, which is concerning for certain. And then our females had a higher percentage of reporting that they were seriously considering attempting suicide compared to our males. And as we all know, our students who are LGB have a significantly higher percentage of being placed at risk, 40.2%. So suicide prevention laws and statutes. In this slide is linked a document that will give you a snapshot of all of those statutes that we talk about today. So you have them at a glance and you're ready to go and have it as a quick reference. So the first one is that suicide prevention instruction is required, and it's required in the health curriculum between 7th and 12th grade. And so sometimes I get asked, does it have to be in every grade level? The state statute says between 7th and 12th grade, so your school district can make that determination. We certainly know that best practice is to have ongoing instruction that scaffolds and has refreshers and reminders and builds those skills. And here's a link to the information that tells you about those state statutes. The other thing I'll share is that, we certainly recommend at DPI, and I know many school districts follow this, that even though it's required within the health curriculum, that including your student service professionals, your school psychs, social works counselors, and nurses in this process is really important, and that collaboration is a huge part of really being a supportive district for your students. So a little pop-up survey, you can just think about this for yourself and see if you started your day getting this answer correctly. What is required by Wisconsin state statute to be included in suicide prevention instruction? And I'll just let you read through those yourselves. You can pick which number you think it is, and then I'll share with you what the correct answer is. All right, so if you picked number 3, that is correct. In state statute, it calls out specifically what must be included in those suicide prevention lessons. And that includes risk factors, warning signs, alcohol and drug use, because there's such a high correlation and connection between suicide and alcohol and other drug abuse, and resources to support students, as well as emotional development. And so what I can say about that is that there are many curriculums that are out there and are available. And so you can choose whatever curriculum you want, and I'll talk a little bit more about that in a moment. But if you choose a curriculum such as, Signs of Suicide, which is fantastic, you just need to make sure that those other components are in there or build them in as well. So this is the actual language here that talks about that requirement, the skills needed to make sound decisions, knowledge of the conditions, and signs of suicidal tendencies, etc. So you can see exactly how that is communicated. I always like to call attention to that last sentence. Instruction shall be designed to help prevent suicide by pupils and by promoting positive emotional development. So DPI does provide a suicide prevention curriculum. This was redone probably 2 years ago now. It seems like yesterday. And the reason we provide this is to make sure that, since it's a requirement that school districts provide instruction, and not all school districts have the funding and the resources to purchase the curriculum, this is another option that they can utilize. We do have curricula for 3rd through 5th, 6th through 8th, and 9th through 12th. At the earlier ages, it's really focused a lot more on that positive coping skills, improving and supporting mental health and emotional regulation and those types of things. We did a lot of work with focus groups with parents and educators and even students, and surveys to get input on what should be included in the curriculum. And there was a lot of questions and discussion around that elementary level and how direct it should be to connected to suicide prevention explicitly. So you'll see that it kind of scaffolds as you go up. The curriculum is available in English, Spanish, Hmong, and Arabic, and there are materials to support the curriculum, including best practices for implementation. And that's going to be found at the beginning of that curriculum document. And it covers things like ensuring that you're thinking about the timing for your lessons, not putting them in during finals week or right before AP testing or before a holiday begins. It talks about including those student services professionals, how to provide that cultural sensitivity and responsiveness. So there's a lot of really good content, and that's where I see the school-based mental health professionals can really support and collaborate with health educators to implement the curriculum in a very trauma-sensitive and thoughtful way. There's also PowerPoint lesson slides. Those might be on pause because they need to be updated for accessibility. They were created by an external entity, and with our new accessibility requirements, those may temporarily not be available. But if you're trying to find them, let me know and we can connect on that. And that's for every single lesson and every single unit. So literally the health educator could take them, make any adjustments that they want to, and put them up and use them to go through each lesson in an interactive way. And then there's parent notification letter templates, because of course we want to make sure our parents know that we're doing suicide prevention curriculum. And so there's a template that can be used or revised as a starting point. And then lastly, there are caregiver companion newsletters that accompany every single lesson and every single unit that tell parents what the objectives and standards were for that lesson, a summary of what the lesson was on, and then some additional resources that relate to the topic of that lesson that parents can pursue to learn about or to engage and interact with their student. So there's a lot of resources that are available. And even if you have a different program that you're using, these resources might come in handy, especially, like I said, if you're attempting to make sure that you have those required components in the curriculum, and you could pull certain things out if you needed to as well. On another note, the health standards have been updated both at the national and state level. So right now, the curriculum is under contract to have it revised to meet those new standards that have been developed. I think it'll be a small adjustment, but just know that those will be revised in order to make sure they align with the new standards at both the state and national level. All right, switching gears to the state statute about suicide prevention resource sharing. So as you can see, professional school staff must be informed of resources available on suicide prevention, and this must happen annually. And DPI is tagged in providing a model notice that can be used. It doesn't have to be, but I have that linked here at the bottom every year that is updated. So currently the 2025-2026 annual model notice is available, and I think it'll probably be early August when the new one will come up for the new school year. And the idea is to provide it in a PowerPoint presentation format so that you can take it and use it if you choose. And if you choose to make any tweaks or changes to it, you also are able to do that. So keep an eye open for that coming in August. And that will be linked on the DPI suicide prevention webpage. There is a toolbar on the left-hand side where it will say laws and model notice. DPI is also tagged into state statute, and we are required to assist schools on training staff to intervene and use suicide. And so we do a couple different things in order to ensure that that happens. So we'll do the standalone trainings as I'm doing today with you as a part of that. And we have some other options as well. I also provide consultation and technical assistance and can be contacted with a number and email located below on the slide, and as well my contact information at the end of our presentation. So here are some of those training resources. There's a link that takes you right to all of the options that we have. Gatekeeper training is intended for all of the staff. It can be used also. Many schools will use the gatekeeper training as their way of meeting the statutory requirement for for school districts to provide resources and information to staff. So that is certainly one way that it can be done along with the annual model notice. This will be updated for the upcoming year, so there'll be a revision to that coming out probably sometime this summer. And then the remaining modules are really meant more specifically for school-based mental health professionals, as well as administrators overseeing that program, and give some detailed information about how to implement some of those components, post-vention policy and planning. Our prevention model is new, and our intervention model will also be coming out this summer. So keep an eye open for those. And all of these are tagged here. There's also another external organization who does training, and they do some training specific to groups like parents and I think maybe students, elementary level. So if you're interested in that, I have linked that at the bottom of this page. You do have to sign up for an account, but it's free. It's pretty simple. So you can check that and see if that might fit some of your needs as well. State statute also requires that DPI provide peer-to-peer suicide prevention grants. And we do that through a competitive grant process, and it's in the biennial budget. So we will be implementing those again this fall. And then every biennial budget that gets reconsidered if that program will continue. So they are intended for high school grades. That is in state statute that we cannot change, 9th through 12th grade. It can be private, public, charter, or tribal schools. The limit is $1,000 per school, but we have $250,000, which allows us to provide a lot of support to a lot of schools. And then it can be renewed up to 3 times without having have to go through that competitive grant process, which helps to kind of streamline your efforts and your time to get that in place. And there are no matching funds required. And so we have a webpage dedicated to that. And I, again, am available to help support it. We know from our YRBS data that peers are most likely to talk to peers. And so our peer-to-peer grants are really intended to give those peers some tools and skills and resources to help connect those students that they come in contact with, whether it's friends or classmates or someone on their sports team, and connect them appropriately when they hear students having a mental health crisis or talking about suicidal ideation and behaviors. It's not intended for those peers to be counselors. That would not be an appropriate role. And sometimes there's a misunderstanding about what a peer-to-peer program really is about. In general, it's an upstream approach, and it's also intended to help support students who are the first go-to for their peers. And so they're taking on a lot as those peers turn to them. And we want to make sure that they know what to do when that happens. And that's what peer-to-peer programs can help. And you may have those programs in your school or have heard about them. Hope Squad, Red Gen, Sources of Strength, NAMI Raise Your Voice are all programs that have been implemented across Wisconsin. Pupil identification cards. This is one of our more recent state statutes that was put into place, I believe, in 2019. And it requires that if identification cards are issued to pupils, then there must be a telephone number, note it's a telephone number, of the National Suicide Prevention Lifeline or one of its affiliate crisis centers, which really ends up being 988 because it all filters through that process. And then if that national line ceases to exist, then you can use another national crisis center line, and it has to be a 24 hours a day, 7 days a week support line. So keeping that in mind, you can kind of think about, do you know if these are on the back of your cards or not? I know when I ask school-based mental health professionals, I get about a quarter of them saying that they know definitively that they are or they aren't on. So that might be a good thing to check on. The other thing that I'll call out is there's some conversations about, it says to pupils. And so when we think about our identification cards being given to elementary students, and what does that mean? So just want to call that out as you think through that process and through what you're doing to be mindful of that as well. And then civil liability immunity. And this is to establish civil liability for acts or omissions and trying to intervene with youth suicide. The legislature wants to know, make sure that school staff know that they can intervene and that they don't need to worry about being sued individually for attempting to help a student who may be suicidal. And so when you think about why might somebody, sue? Well, I don't know, perhaps you hold a student because you think that they are not safe to go home and the parent has to take off of work to come get them and the parent gets fired. Do they want to sue you? I don't know. Or you hold a student because you don't believe they're safe to go home and that student misses the tryouts to, a team or a playoff game, and the parents, and the student take issue with that. So just knowing that, I think, is helpful and important. So in summary, we know that these laws and administrative rules are really clear, that schools must educate students and staff about suicide prevention, and DPI as an agency must support schools in that process. And again, I linked that reference to all of our state statutes and administrative rules related to suicide-based prevention for your reference. And then to end, I just want to share this. My children both were in tennis in high school, and their coach was the school district health services nurse. And she would always say to the girls, by the time you're thirsty, you are already dehydrated. So you got to drink early and often all day before those tennis meets. And it always reminded me of the work that we do and how sometimes we don't realize how burnt out we are or how, emotionally laden all these things that we're dealing with are, kind of until the signs and symptoms have already kind of taken over. So just a reminder to all of you that as you're doing this important work, whether it's suicide prevention or special education or crisis response, meeting all the needs of all the students, that it's really important that you keep drinking water and take care of yourself. And then here's my contact information so that if you have questions or concerns, you can reach out to me. I also put in my Gov Delivery school counseling news, which is information that I share out from our student services section about no-cost opportunities and resources and updates about things that are happening, not just for school counseling really, but through our entire section and our division. and related to mental health. So if you have an interest in signing up for that or want to share that with some of your school-based mental health professionals, it's a great way to keep abreast of what's happening and what opportunities exist. All right,
Andrea,
so I'm going to stop sharing and see if there are questions.
Sorry, Andrea, I do see one question in the chat. I don't know. Do you have access to the chat or would you like me to read it to you?
If you want to read it, just because I'll be scrolling to find it.
Yep, it says, is DPI doing on-site suicide prevention training for schools at CISAs or other venues? If so, are you offering information about just the DPI classroom curriculum or including other options?
Okay, great. Great question. So the curriculum, when it came out 2 years ago, we did go around to CISAs and regional areas and provided training on that curriculum. At this point, we are doing the online modules, and we are in the process of creating some school-specific trainings on prevention, intervention, and postvention. That is a project that will be underway this coming school year. And certainly if schools, have an interest in on-site training, feel free to reach out to me and we can coordinate and connect on how and what that might look like.
Are there any other questions for Andrea at this time?
And while we're giving people a moment to see if anything comes up, I will share out that through the Garrett Lee Smith federal grant that we are partnering with Mental Health America on, each of the CISAs are providing a training on a suicide prevention framework for how to intervene in a systematic way as students are experiencing suicidal ideation. And it's called the Safe Side Care, which includes connect, assess, respond, and extend. And it's a no-cost training. And every CISA except CISA 2 is offering that. So I can also share that information when I send the PowerPoint in case that's something that folks are interested in sharing back or being a part of as well.
Thanks. And I see Madeline just dropped that in the chat as well, that all CISAs are offering Safe Side. So same
Thank you, Madeline.
wavelength there. I don't see anything else in the parking lot. So thank you so much for all of the information. Certainly, if someone has a question that drops in the parking lot, we will have Erin or Jen get in touch with you. But thank you for the information. We appreciate it. We appreciate your time this morning. And my apologies for pronouncing your name wrong as I introduced you. I missed the little accent on your name. So my apologies, Andrea, on that. But thank you again for joining us. If anything comes up, we'll let you know. And for the rest of the group, we are moving on. I believe I saw Carrie Wilson-Smith jump in, and I think we're ready to move on to that.
All right. Can you hear me?
Yeah. So Carrie, I believe you are here to do just a brief overview of some of the DPI calls or information on that, correct?
Yep. Just give me 2 seconds.
So welcome
here.
to the space. Good morning. The floor is yours.
All right. Good morning, everyone. Can you see my screen?
Yes, we can. Thanks.
Except it's not in the right spot. So let's get this to the right spot. All right. Apologize. Let's start it there. There we go. All right. Good morning, everyone. My name is Carrie. Oh, sorry. My name is Carrie Wilson-Smith, and I am here today to share with you the parent data from the Department of Public Instruction. I am the Information and Support Specialist at DPI. I am contracted to perform these responsibilities I run through CISA 12 with Jen, and I sit on the customer service work group, special education customer service work group at DPI. And so my job is a little complicated. It sounds complicated, but it's really not. What I do, and I'm going to get into that in just a second, is I talk with every single parent that calls into DPI that calls special education or email special education. So just so you know, this isn't my first rodeo. I have 38 years of experience in special education. I was a director in both Minnesota and Wisconsin. My passion is transition. So I was a work-based learning coordinator in Minnesota and a transition coordinator here in Wisconsin and an ID teacher Last but not least, I am a parent of a child with a disability. My daughter has an ID disability. She's 33, doing wonderfully, independent, pretty independent, and I'm very proud of her. People ask me frequently, did you get into special ed because you have a child with a disability? And the answer is no. She was born after I had already been in special education for multiple years. So how do parents find me? A great question, right? And so I just wanted to share with you, how can parents find special education customer service? We have this wonderful document that says what happens when you click the green button. And on every one of the special education pages at DPI, it has contact special education. So when you click that button or you call the number, you're going to get to our customer service, special education customer service work group. And what happens is once that call comes in, there are four of us that triage all of the calls and emails that come into the customer service work group. That includes you contacting DPI for questions and concerns, and we route those. All parent all parent calls go to me. And so there's multiple ways parents can get our information from the internet, through word of mouth, through their CLTS workers. And I want to say, I'll talk a little bit more about this, but I do want to say that the numbers are steady. The contact the green button has been amazing for a lot of our families that may have their own limitations and abilities. So it's been really helpful, but we remain pretty consistent on the numbers of people that are contacting DPI. Previous to, and I have no idea why my one circle is missing, but I will put it in there in a second. Previous to me, when a parent would contact DPI, they would go out to a consultant. And one of the reasons that this position was designed was for consistency, that every parent is getting the same information consistently using DPI resources. So that is why one of the reasons this position was designed. Plus, the capacity for all of our consultants just wasn't there. So what happens when a parent does contact the customer service work group? What happens is we get their ticket. The next thing that happens is it's either a call or an email that we get. Then once that call or email comes in, it's logged and it's given a case number. So if you ever hear a parent say, I have a case with DPI, that is just how we keep track of all the information coming into DPI. And so we track them using case numbers. It doesn't mean they have a complaint. It just means they have made contact with DPI. You also get a case number if you contact DPI for information or support. So that case number is five numbers and then a dash and three numbers and three letters. And so that's what that looks
How are
like.
you?
Oops.
The director at Clear Lake.
Somebody's microphone is open, just so you know. If a parent, okay, and then so next thing, I'm going to call the parent. I call every single person that puts in a ticket to the Department of Public Instruction. So I either, I make multiple attempts if I'm not able to get a hold of them right away, but I contact them via phone. And what I do is we discuss why they're calling. They're not always calling for a concern. Multiple times they're calling just to get some information. Maybe they're a new parent and they don't know the process. And I'll show you some of the calls and what we get. Once I talk with them, and that phone call can be anywhere from 15 minutes to 2 hours. It just depends on the need and the information. I take notes and then I follow up with them in a verbal support answer and then also via email. Now, where does the district come in? The district comes in if I hear a concern. If I hear a concern that is potentially moving to a complaint, or I think, you as a director need to hear about it, I loop to you. I've contacted hundreds of you over the 5 years that I've been here. And sometimes I email, sometimes I call. It just depends. And the point of my contacting you is, and why do I loop in the last piece of the big circle is because I want to make sure that there's transparency in every concern. I want you to know what they told me. I want you to know what resources I provided them. And I want you to be able to say, hey, you know what, we might need some assistance with this. Is there somebody that I can talk to or I can collaborate with? And so it's not just about sharing concerns. Collaboration is one of the key pieces here. And some of the directors that are sitting in here today, I've collaborated with, and it has been very beneficial with collaboration because I've been able to maybe potentially where a parent didn't have that trust in the district, been able to bridge that gap through that collaboration. I am also available to assist a director if you need resources or if you need just connections with a specific consultant. So that is always something I can do for you. And the big thing that I do is I collect data. And I collect a lot of data, and that's what I'm going to talk about for the rest of the presentation. The data I collect is from the phone calls, and I collect the school district information. So what school district was the child in? I collect CISA region information, regional CISA information. For example, in April, CISA 8 one of the CISAs had a huge spike, like 15 additional calls this month. And so to me, when I pass this information, I'll talk about where I send this information to. When I pass this information over, it's an opportunity for districts and RSNs and the regional collaborative WISPE team to take a look and see maybe why there were extra calls this month. I also document the reason for the call if I contact the district, and then if I'll talk about the referral process, and then repeat callers. So anything that I refer out to another agency. So for example, if I say, oh, would you like to work with a WISPE coordinator? Let me get in contact with them and we'll see if we can get you set up. That's a referral out. Or if so I document who I refer out also. And so let's look at some data because the data is really important. This is my data since 2022. This is the number of calls that come in that I take each year. And so I'm currently almost exactly at the number 900. I might be over now because today is a new day. But, and I have May and June left to document information for. You can see the numbers are pretty steady. We didn't start collecting this data until November of 2022. So that is why I wrote that's not a full year. And so the reason I collect the data is to be able to, share with, and I do share it with DPI staff, consultants. In fact, I believe Daniel Parker's presenting to the admin team some of this data too. And to provide you with an opportunity and the regional CISAs opportunities to see, what's going on in your area. So this is the data we have the data so far this year. And I have categories that I use, and one is disability area, dispute resolution, evaluation, reevaluation, IEP, related services, safety, parent support, and then the other. And so as you can see, a lot of our calls are about the IEP and it's about implementation. And so that is the biggest piece of our pie. Dispute resolution it's only 12.1, but it really, in essence, it's bigger than that because when I get to evaluation, reevaluation broke down, you'll see why that piece of pie is so big. So I'm going to go through each one of these and give you some examples and then talk about hot button issues. So this is exactly what my data looks like. And this is the top calls so far this year. And as you can tell, our number one call that I get is child find. So when you think about child find, there are a lot of parents that don't know what to do, and you don't know what you don't know. So I'm more than happy to walk them through the referral process. Some districts have very specific referral processes, and I try to, utilize your district's process if I am aware of your process. The bigger districts like Madison and Milwaukee have very specific processes, and I use those. You can see that the second one is filing an IDEA complaint. And why do parents file IDEA complaints? Well, all the other areas that I'm going to talk about is one of the reasons why they do it. I'm going to go into that in just a second. So, IEP placements, those are placement decisions that parents are disagreeing with or maybe have questions about. It's not always about disagreeing or being upset or having a concern. It may be just they don't understand the placement piece. IEP implementation is also the fifth one. And then some of them are broken down into IEP placement and then specific topics such as homeschool, open enrollment, expulsion, private schools, virtual schools. So I break those down into more categories. Now, 504 plans, I will tell you, has been that number has risen dramatically. In fact, when I gave that number to Daniel a week and a half ago, it was at 41 and now it's at 46. So there are a lot of questions going around about 504 plans. How are they being utilized? How are they being implemented? And with the Department of the federal government downsizing OCR, and removing those 5 offices, families are not getting responses from OCR. And so they're looking to us for information. Unfortunately, DPI does not process 504 complaints at all. We're hands off. That's the Office of Civil Rights. So it becomes a bit of a conundrum when parents are calling for us help in the 504 area or they have questions and there's not a lot that we can do here. As you can see, I just posted the top ones. I would say the one thing that is consistent is the bullying and transport. There's always transportation concerns. Always, 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 always. There's never not going to be transportation concerns. Those are pretty steady. I would say open enrollment. I expect that number to go up greatly because on June 1st, when some of the letters go out, we get a lot of calls for open enrollment that students with IEPs have been denied. And so that is, we also know what part of the year we get certain calls, and I'm prepared for June 1st. All right. By the way, all this information is linked in this PowerPoint to a bigger piece of data that you can look at. So as I break them down into categories, our disability area, again, I told you we have a lot of calls on 504 plans. The rest of those are basic information questions. So parents are asking about early childhood special ed. What does it look like? How do I get involved? What is a referral? And so a lot of those questions are a lot of that data there are questions. The next one is dispute resolution. And as you can see, filing a complaint, I had 63 parents that I shared that was their number one concern. And a lot of my calls might have layered or leveled or additional side concerns or questions. I go with the biggest concern that they share. So one thing I did realize by looking at my data is that I don't know what all those complaints were because I didn't let me rephrase that. I didn't document in data what those complaints were going to be about. And so next year I'm looking because I always want to improve my practice and improve information that I can provide for everyone. I'm going to be taking that data and including that into my new data, my fresh data. So I will be including the 26-27, why are they filing a complaint information? So I don't have that this year. And let's go over to the evaluation, reevaluation section. When you look there, of course, you see that we have 99 child find referrals. And that is a lot. It's a lot, but I can tell you that if I've walked them through there, they have some idea of what a referral looks like and how to complete a referral and where to go for that. Second one was IEE. We do have a lot of parents challenging right now. The student doesn't qualify. They don't agree. Mm-hmm. A lot of times what happens is we get this medical diagnosis from a doctor and they come to me and say, I have a medical note. I have a doctor's note and I want an IEP. And so one of the things that I'm challenged with and take that challenge is to explain the difference between educational and medical diagnosis and what the difference is and what it means when a student requires specialized instruction versus they have a disability, but they may not require specialized instruction. So there's a lot of doctors out there that are saying those very same words to families. And I'm sure you've spoken with them as they've called and said, I get an IEP because my child's doctor said so. And so it's a hard discussion, but we do the hard work, right? And so that's what I do. We have those conversations about what that looks like. And sometimes I use some practical examples. For example, that I have a disability, but I don't require any accommodations for my disability. Maybe someday I will, so I always talk about, try to use a real life example. So these are some of the reasons why families are calling in for evaluation. Sorry, I have a cat that just decided to love me. Um, so the next area is related services, and really, related services is just transportation nursing. And I had a couple speech and language calls. I do like to consult with Don Mirth Johnson when I have a speech and language question, because that is not an area of my expertise at all. And so I go to the people that are in that area. Um, Also, let's do safety, bullying, and educator misconduct. We've had an increase in the parents calling about educator misconduct this year, stating that a special education teacher put their hands on their child or, said something inappropriate, threw something at them, just those pieces. A lot of our complaints, um, I'll talk about that in a second, but a lot of some of our complaints fall under the seclusion and restraint. We've had multiple seclusion and restraint complaints where, um, you know, parents are saying the student was either secluded too long, restrained improperly, not provided documentation for that. So those are some things, those fall under the IDEA complaints. A lot of those do. Staff shortage wasn't as a big a deal as I thought it was going to be this year, but staffing concerns have increased. And last, parent support or education. We have a lot of parents that called and asked me to be their advocate, and I explained to them that I am a neutral person. I do not provide advocacy, and our parent organizations advocacy. So I walked them through some of the parent support and frequently talk about Wisconsin facets. They are sometimes referred to disability rights. We used to refer to Wisconsin family ties and WISPY, of course. And so all this data, let me tell you this too, goes to they changed their name, the WISPY regional coordinators. I'm sorry, they changed their name and I can't remember what it is. They all have the data every single month. I provide them with the data in your CSAs. And if you needed to look at your data for your district, because I go down to district level, I'm not sharing that today because I don't think that would be appropriate to share it statewide. But you can certainly get your district's data from your coordinator if you wish every month. And so this is all shared out with them. And I share this in a different kind of report for them. So it breaks it down to what district called and why did they call. So they even know right down to that detail. All right. There's so many things that don't fit into a category and we call that other. And so I have a lot of other calls throughout the year. One of the bigger other calls is the attendance and truancy. My child is truant. I just got a truancy ticket, but he has an IEP. They can't do that to me. That is a frequent statement that I get from families, and we have to walk through what is truancy. Is it part of the disability related need? And so we walk through that language and talk about those things. Non-discrimination, I do get quite a few non-discrimination calls. And if you're wondering what SSPW is, that Student Prevention and Wellness Team, those are calls that I got that just went right over to them because they're the area that needs to have them. We have parents who don't like case manager changes. We have parents who don't like a particular paraprofessional. We have my computer decided to do an update right now. We have parents who just don't understand, what to do because they moved into the state. We have angel sense questions. We have, my child needs a wheelchair for a little bit. So there's multiple different reasons why there's other categories. I do get some, like, can you put outdoor education in an IEP? That's just one, a parent question. The district's getting rid of all the self-contained programs. What should I do? Which then when I contact the director and find out that, of course, that's not the case, I can circle back to the parent and talk about that and what that really looks like. These are just some of those areas. I'm running out of time, so I'm going to go quickly. Hot button topics. Well, these are the hot button topics this year. Suspending due to disability related needs is probably the number one hot button topic right now. My child was suspended. It's part of his disability. Why is he being suspended? And frequently, I know the answer already. It's because that child has hurt somebody. And, we do have a threshold in schools where we have to keep everybody safe, including teachers. And so those are hard conversations. Open enrollment with an IEP. I'm going to shop around for a school. I heard this is the best district for special education. And so a lot of that 504 plans. Parents wishing to file a complaint and not willing to work with the district, because the first thing I ask a parent is, have you talked to the director of special education? Have you talked to the case manager? Have you talked to anyone in the district about your concern? And if you haven't, that's the first place you need to go, because we want to resolve concerns at the lowest level, which would be in your district. But I do have a lot of parents, don't even talk to me. I'm filing a complaint right now. Give me the paperwork. I'm doing it. And so I wish that I could convince them not convince them, encourage them to talk with the district and work with the district. But that's not easy when parents are elevated. ABA, I want my child to go to ABA for part of the day and school part of the day, and they're over 6 years old. Well, we have mandatory attendance policies, and some districts work with families. Some districts have policies where they won't allow that, and that's up to every district. Teacher behavior towards students, just the negativity. I hear, well, I just had one today. Well, the teacher called my child stupid, and I hope that wasn't the case, but that's what we're hearing sometimes. And believe me, I know what I hear from families is only half the story, and that's why I sort of loop to you so that you can, understand the perspective the parents coming from or what they're seeing through their lens, and then go from there. I do not take everything with truth. I get it. I get that sometimes we're getting mixed messages from families. Behavior intervention plan. And I would advise districts to reach out to Catherine Smith. I spent some time with her last week at the WCAST, and she's an amazing resource. Behavior intervention plans are tricky and they're fluid as as behavior plans work and extinguish one behavior, another behavior may pop up. And so they're very fluid and have to be reviewed quite frequently. And I think some parents also don't really understand what the intent of a behavior intervention plan is. Shortened day due to behavior, and sometimes we know that is because people are getting hurt, and that is understandable. But a lot of families don't have options when they're put on a shortened day. What am I going to do with my child? I have to go to work. So again, I'm listening to what the families are saying, knowing that, of course, this is a collaborative situation. IEPs are supposed to be collaborative, and that might not be the true lens. Paperwork, timelines, IEP meetings, scheduling continues to be a concern because parents can't meet until after school. You have contractual obligations with your teachers. I get it. Unlicensed staff, there's a lot of teachers out there in emergency licenses and may not have the background knowledge for special education, and that is also a concern. And private school students wanting full special education services is a big one. All right. Now, I know I spilled a lot of information out in like 20 minutes, and I totally understand. And that's why you have the PowerPoint presentation to go ahead and review at your leisure when you have time. If you wanted additional data or information, you can certainly contact me directly. You can contact your WISP regional coordinator, or you can, you can just give me a call and I'd be more than happy to provide that information. I wasn't. I do see a question. In your conversation with families,
labor is $512. Would you like to reply? No. Okay.
uh, uh, in conversation with families, do they report if they are using AI to? Great question. So yes, they do, and I tell them no, 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 no. Because when you Google, if you just do some Googles and try to see, like a special ed law that we have specific to Wisconsin, you're going to get Arizona's, Texas's, Massachusetts. You're going to get all these other areas where this information is not necessarily accurate. So when a parent does identify that they've used AI, I I I I tell them that I can provide them with the DPI guaranteed information that is for sure the truth. The truth. Because AI just doesn't always give us the truth. In your conversation with families, oh yeah, okay, I got that one. Any other questions that anybody has for me? You're welcome. I want you to know that anytime you talk with me, I'm really excited to collaborate with you if you want to work together. And I absolutely am a transparent person, and I really try to make sure that you're getting the information that I got so that we can all be on the same page to work with families. And remember that, a family that calls, they're usually upset about something. Well, not that usually, but they are upset about something. And, sometimes they just need somebody to vent to. And sometimes I don't even speak for a whole hour. And that's okay. That is okay. And, sometimes they just need to know that somebody's listening and then walk them through what resources they can utilize. Again, I'm going to refer them back to the director first and foremost. All right. Thank you, guys.
Well, thank you so much, Carrie. We appreciate it. This information can certainly help us think about our systems, communication, and partnership with families. Those of you on the call, we certainly would encourage you to reach out to your WISPY Family School Partnership Coordinator or Carrie if you have further questions or are looking for ideas to partner with families. If you are like maybe something struck a chord with you and you're like, gosh, I don't know how to enhance this. So those are always options for you. Those of you on the call, this is time where we are going to take a short break. Let's return at 11:05. So we're going to take a short break. We're a little bit behind, but that's okay. We are going to return at 11:05. About school-based services and mandatory compliance. Presenters, I invite you to introduce yourselves before you get started. I was given a list of several people and I'm not quite sure who's taking the lead. So welcome to our space, and I invite you to share screen and introduce yourselves as you are ready.
All right, thank you. Let me just grab the screen. I'm here to share. Oh, I'll start with my name first. My name is Alyssa Zirk, and I am a program and policy analyst with the Department of Health Services in our Division of Medicaid Services. And I oversee our school-based services, so like our Medicaid claiming for school-based services. And then so I'll be presenting most today. I believe I also have our project manager, Grace, here today to kind of help me out with any notes and to listen in. So
yes, hello everyone. I'm sorry. Hi everyone. My name is Grace Sampson, and I am a project manager with the Bureau of Physical Accountability and Management. And school-based services is one of my projects. Kind of coordinate the fiscal side of things. But yes, I'm here to just be a buddy to Alyssa and help with note taking as well. Nice to meet you all.
Yeah, so I will go ahead and get started. If you can all see my screen, I just have a forward health update here for all of you. And I am going to grab the link to it, put it in the chat so that you can all have the link to that as well. And I have a couple other like links that I'll be putting in the chat. And I have the chat up. So if you have any questions or anything during the presentation, I'll take a look at that from time to time. So why am I here today? We have several changes and things that we have to come into compliance with under school-based services. So the Center for Medicare and Medicaid Services came out with some guidance in 2023 after the passage of the Bipartisan Safer Communities Act. And in that guidance, they required updates to our random moment in time studies that schools have to complete in order to claim for SBS. And then it also narrowed the definition of what we can claim for transportation services. And then we also received a corrective action plan from CMS surrounding prescribing, referring, or ordering providers getting their individual national provider identifier on SBS claims. So those are the three main things that I'll go through today. This is going to be, I know I was here last year to talk about our school-based services expansion and allowing students who do not have an IEP who are on Medicaid to also receive SBS services. So that was like a little bit more fun. And now I'm coming here to make everyone's day maybe a little bit worse. So I'm sorry about that. So I'm gonna get more into what CMS is requiring for national provider identifiers. I'm gonna call it NPI from now on. So essentially, we received this corrective action plan, and by federal law, which was actually passed in the ACA about 10 years ago, is that all services that require a prescription order or referral need to have that prescribing, ordering, or referring provider's individual NPI number on the claim when they put that into we call it our MMIS, our forward health system, where like schools claim for SBS. And so I'm probably going to start calling it a PRO or a pro. So whenever I say that, I mean prescribing, referring, or ordering provider, just as an FYI too. So because of that requirement, we will now require a PRO for the following SBS allowable services. So on every claim that a school, puts into our Medicaid system for nursing services, OT, PT, speech and language pathology, and attendant care services will require that type 1 NPI number. And so that essentially means, I'll get into a little bit more later, that essentially means that these providers will have to go and get their federal NPI number is the first thing that they'll have to do. And then the second thing that they're going to have to do is enroll as a prescribing, referring, or ordering provider in our Wisconsin Medicaid forward health system. Any questions so far?
Yeah, I'll have a question. I was just going to type it in the chat, but I will actually unmute, and I didn't realize my camera's off. Sorry about that. So who's the prescribing provider for attendant care? Just overall, is it our nurse? Is it
Sure. Yeah. So attendant care, it is kind of more individualized. So, like physician, physician assistant, nurse practitioner, they can, prescribe anything. And I know that's probably like not a thing that schools are really going to utilize a lot.
Right.
So for attendant care services, we have talked to like school nurses, and that is like IADLs and ADLs are within their scope of practice. And school nurses are going to be able to enroll in our system.
Okay, and that would include like, toileting needs, some of our orthopedic health impaired students that are orthopedically health impaired in
Yeah.
wheelchairs, in walkers, then it would be the school nurse that would be
It
prescribing
could
that.
be it could be a school nurse. It could also, so we use the like provider within their scope of practice language a lot in Medicaid. So like if some of the attendant care services were like a part of, like as a result or something that like the physical therapist is also working on,
Oh,
uh
okay, okay.
it could be like them, prescribing too. So it really is like individualized, like what attendant care service they're getting.
Okay, and like OT for regulation could be the same, correct? Okay.
Yes, yes,
Okay.
yes.
That's clear in my head. Thanks.
Well, yeah, you're welcome. Let's see. We have another question. Our paraprofessionals perform, so they need to be under school nurses. Well, I think it is because it's a little different. So it is the prescribing, referring, or ordering provider. So like for school-based services, we previously, they require an IEP, we require like a plan for services. So it's really more about who refers the services on the plan and less about who's like actually delivering the services. So you'll kind of, so, we will allow for like other providers to like review a plan, or like review an IEP and then give that kind of like okay or like recommendation for those services. Um, but it is really only those. Yeah, so it's really kind of like more about like who's recommending the plan and less about like who's like doing the services, if that makes sense. So let me see if I got some of the um how does a school nurse register to be a PRO? I'll get into that a little bit later. Who would be the referring provider for attendant care and services for behavior? It could be a school psychologist, but that school psychologist um, would have to get an MPI and enroll in Medicaid. You'll see that we don't have school like mental health services and school psychological counseling and social work services um, as services that require an MPI. But then you're right, that does get a little complicated if like the student is also getting like behavioral health attendant care services. So if a school psychologist were able to like get an MPI and meet the like qualifications in order to like enroll, then they could be like a prescribing provider on attendant care.
Alyssa, do you think we should like finish covering like the entire public
Sure,
health and
yeah,
then we'll review? Because some of the questions, I think
I'll
we
answer.
answered them. Yeah.
Okay, cool,
So we
thanks.
could do that and then we'll open up the chat for more questions.
Cool.
Thank you all.
Yeah. So this next part is, so school districts are going to have, we're allowing them several options to meet these requirements. So kind of like what I said in answering the question is that the school could hire a contract with a physician, physician assistant, advanced nurse, advanced practice registered nurse, to refer those services. And we, as part of our SBS expansion, did allow for like schools to contract with a physician or like physician assistant. We understand that's probably not something that like a lot of schools are going to do, but that is a possibility. So the physician could be like contracted with the school, and then the physician would need to be enrolled in Medicaid. The second system for families and schools to use would be they could take the child's treatment plan to a primary care provider who's enrolled in Medicaid, and then that primary care provider could sign off on the plan. We understand this is also kind of like another level of difficulty, right? Like if districts were to choose that option, they'd need to make sure that like families knew what to say when they were talking to their primary care provider. Might need to make like some informational sheets or possible forms for that option. So we do think that, you know, the most viable option for schools is to have them have, you know, PTs, OTs, SLPs, school nurses, et cetera, get that MPI and then enroll in Medicaid as a PRO provider so that they can then refer those services within their scope of practice. And then, like I said before, we do have dental services, mental health services, physician services, psychological counseling, social work, and transportation services. At this time, none of those services are going to require the prescribing, referring, or ordering provider. And we've been getting some questions lately about like what does that mean? And we do have in the Forward Health update, we have our topic 1480 listed. And hopefully you guys can see when I switch over. So this Forward Health topic gives out a list of all our procedure codes that we allow for school-based services. And then we have each category listed out at the top. So anything, you know, under speech language pathology would require a PRO, OT, all of these, PT, etc. And then so you see like all of these that are under psychological counseling, social work, and mental health services will not require that PRO at this time. And so now we kind of go into like how do they actually get an MPI and how do providers actually enroll in Medicaid. So it is going to be a two-step process. The first process is going to be to go to the National Plan and Provider Enumeration System website and obtain an NPI. That's a pretty easy process. I think you just you sign up for it and you get it, so it shouldn't be too much of a barrier. And then after they get that MPI, they will have to enroll in Medicaid, Wisconsin Medicaid, through our Forward Health website as a prescribing, referring, or ordering provider. Now, this provider type in our website, it's not like a full Medicaid enrollment. It's basically like Medicaid enrollment just to make the referrals. So it doesn't require as much of an application process as it would to become like a billing or rendering provider. But we have our provider enrollment information page and then some more resources. We're also our contracted agency Gainwell, who administers all of our systems, is putting together a like online training to kind of help schools like more go through this process and to, like understand, you know, like all of the pages that they'll have to click through and everything and like how to get through our portal, because our portal is not the most usable system. So we're trying to give out more information as we can. So yeah, essentially providers will have to click through, they'll get they'll open up like their application and there'll be a bunch of screens that they have to click through and put in all of their information on. We have a little bit more information, like school nurses will be able to register under a nurse in independent practice or private duty nursing based on their qualifications. And then a school speech and language pathologist can enroll with as a speech language pathologist provider type with a speech therapy specialty. And then one other thing to note too about SLPs specifically is we've been having talks with DPI about this, and I did just double confirm it today, is that in order to become a PRO, the SLP will need their ASHA certificate, which is like a level higher that not all school SLPs have. So things are a little bit more complicated for SLPs because they don't have, not everyone has that specific certificate, and they don't all have that Department of Safety and Professional Services license. So we've been kind of talking about different ways in which SLPs can like be that referring provider, do things like review plans and stuff like that. That like other SLPs who do not have that ASHA certificate reviewed plans, that other SLPs create. And then during the online provider enrollment process, if a provider has a license with DSPS, then they should put that license number in. But if they don't, they can use their DPI license number. And another thing to note too is that if a provider is already enrolled in Medicaid, like for, if they're like a community provider, they're enrolled in Medicaid for another reason, they don't have to enroll a second time. So that's just another thing. Once you're enrolled once. So you don't have to enroll more. And then another question that we've kind of been getting to is surrounding like addresses, like what address should they put in? And they should just be putting in kind of, because especially providers might work at like multiple schools. So essentially it's our Medicaid policy to just put in whatever address like is your primary address or like where records are kept or something like that. And that can be your address for Medicaid enrollment. You don't need to put in like multiple addresses. So I know that was a lot of information, and that's just 1/3 of why I'm here. So let me see if there's anything that I missed in the chat. Does a school nurse then need to attend all IEPs to recommend the service? I think so, yeah. We're kind of making it so they don't actually have to like attend everything. They could be signing off on other people's recommendation. Does that mean each team will need to have either an OTPT or nurse on the IEP team in order to bill for attendant care services? Again, I think it wouldn't necessarily need to, the person wouldn't need to like attend IEP meetings. I think they would just, it's more of like a referral or a recommendation. So if they're like reviewing the plan and giving the okay, we would consider that enough. And it's all kind of like about documentation too. So like just making sure that MPI is getting like documented either like directly on the plan if that's easy, or like in another way. We just need that like recommendation for services. How do they sign off on those recommendations? And do those services include behavior support such as task reminders? So yeah, like I said, they could sign off on those recommendations just by like if a school wanted to like on an IEP put like a little like area on it just like for that sign off, we would accept that just to like write that MPI number down. Or like yeah, or if there's like a separate kind of like recommendation form or something that goes along with the IEP that like attests that they like reviewed it and recommend the services that were written on the IEP, kind of like something like that. And do those services include behavior support such as task reminders? I don't know if I might have to take that question back. I think it just, gets a little money. Like if it's under attendant care and you're claiming it as attendant care in our system, then it would need to be, we would need that recommendation. And it is like a little weird, right? Because like how we as Medicaid determine like what's a service and what's on the IEP as a service. There's always like a little bit of that mismatch. So for us, it really is about the procedure code that is being used. So if they're billing for attendant care and they're using the attendant care procedure code, then we would need this one, S5125. Then we would need that PRO. There's like a special box on a claim that they just like need to fill out. And then again, have that documented in the student's record as well. I will wait just a couple more seconds and then move. Oh, when EAs go into bill, they will not need an MPI to enter services if there is no nurse, OT, or PT on the team. Again, I think it does depend, yeah, like on the service and like what services the student is getting. So if they're using any of those procedure codes under the list, then they will need the MPI. Will recommendations be required annually or multiple times per year in line with IEP meetings? Yeah, I mean, essentially, like if you're making like anytime, yeah, you make like a new plan, you would still need like that recommendation. So if you're like updating the plan or anything like that, you need that recommendation. Are we required then to provide their MPI directly into the IEP? And what section is the documentation in the IEP? So we as Medicaid aren't specifically saying like where the MPI needs to be, just that it needs to be documented. So I think if it's easiest to just like write it like on the IEP or include it in the IEP, then that would probably be the way to go. But we would also accept documentation in other ways. Okay. Cool. Typically, we don't put as a person could transfer to a different district. So yeah, I mean, yeah, I think now if it is like a Medicaid enrolled and you're claiming for Medicaid, you would have to put on a specific person. I will keep sending questions in. I'm gonna move on to the next topic, which is updates to random moment time study changes. So for SBS, a little background, like, SBS is a cost settled benefit for Medicaid. So the MPI number is part of that like initial claim that you put in, and you work within our forward health system to add that claim. And then kind of like the second part that happens is, providers have to do these time studies that our contractor PCG sends out. And they have to, like log into their little online portal and report like what they have been doing during the time study window. So previously to CMS changes, we were able to provide districts with a 5-day notice of these time studies. After the mandated changes, we can only provide districts with 2 days notice for time studies. So those will be, PCG sends out those emails, and they are working on, sending out like reminders and sending out the notices to like as many people as they can so we can get those moments completed. But schools will have less notice on when those moments are going to be. And then the next bullet is that staff will only have 2 school days to complete their moment now, when they previously had five school days to complete their moment. And it is 2 school days. So, if you get a moment like on a Friday, we're not counting the weekend. PCG also has their system set up to know like when schools have when schools have time off, things like that. So it also won't affect like if a district doesn't have school that day also will not be part of that 2-day moment, but we are significantly reducing the amount of days that staff will have to complete their moments. The other change that CMS directed us to do is that we now need to include all regular school days from the start of the school year in our time study. So previously, we did not require days that were before like September in our time study. Now, if a school starts like the regular year in like August or something like that, schools will receive moments for that month. So it is based on the beginning of the first day that the staff reported back to work for a regular school year. But then to kind of try to mitigate some of these things, we have also changed our time study requirements from quarters to semesters. So what that essentially means is schools will be receiving a lot less moments. So because we were on a quarter time frame, schools were getting like a lot of moments, and I never remember the exact number of moments, but it will significantly reduce the number of moments that schools have to do. So those are our time study changes. PCG just finished off 2 weeks of trainings on time study changes and the specialized transportation changes, which I'll get into soon. And so right now we have their training listed on our Forward Health Provider portal page. We have the PDF up right now. And then we are getting a recording from their trainings. I'll put this in the chat too. We're getting a recording from one of their trainings so that we'll have that up too for schools to look at if they weren't able to attend one. Just because PCG has like a lot more information about like how things need to be entered in their system and like strategies for how to complete their moments and everything. So I think just I'm gonna go to specialized transportation next, and then I'll come back for questions. So the next thing that we have to update is CMS has narrowed the definition of specialized transportation to mean that a child must be transported on a physically modified vehicle. So previously, we could claim for transportation if there was like an aid on a school bus or something like that. We can no longer claim for that. So whatever vehicle the student is in, it has to be physically modified. So some examples are like a wheelchair lift, a ramp, or a specialized harness. And in PCG's trainings that they did in the last week, they had a lot more information on like how schools can review the impact of this change for them and how to maybe try to like mitigate some of the effects and trying to just like prepare for it. So I would highly recommend going over and looking at PCG's slides on that, because this is also going to be a pretty significant change, and we think a pretty big hit to schools' budget, especially rural schools. So yeah, those are the main changes, and I will go back up and check out, see if I can help out with any more of these questions. Okay. Also wondering about a release of information for us to share an IEP document with Medicaid. I think DPI has more information on their website about those releases. Oh, and people just strategizing where to put it in the IEP. Nice. I think the problem with EAs and special ed teachers getting an MPI is there isn't currently a federally allowable provider type for a special ed teacher. And so we don't, and like Grace said, yeah, we only require it for people who are prescribing, referring, or ordering. So at this time, it's not providers who specifically like render the service. It's about that like recommendation to eventually render the service. But yeah, that's all I have. And like I said, we are planning to send out more information about the MPI requirement and send out a training. We also have a FAQ document that is on the same provider page that we're planning on giving a little bit more updates. We've been getting a lot of questions like you all have sent in, like about attendant care and stuff like that. So we'll give out a little bit more. We'll give out more information on that to help out. But this is the website where we post all of our updates and everything. So it's a good thing for you to have and to share. And when we, when we have this training live and when the FAQ is updated, we can send out communication too so that people know. that they've been updated as well.
Melissa also added that link to the chat for anyone that needs to access all these pages. So please feel free
Thank
to
you.
access those.
Cool. But yeah, that's all I have. Yeah.
Any questions?
everyone.
I think we still have 3 minutes before our time is up. We'll take any more questions. Well, no news is good news. I take it. So thank you all.
Yes, thanks
Appreciate your time.
everyone.
Alyssa, I did capture a few things in our parking lot. I don't know if maybe Erin or Jen can share that link with you. And I was trying to kind of write answers as you were speaking. But if I incorrectly captured answers or if you want to elaborate on things, because I tried to kind of go through the chat because things were kind of coming in rapid fire as you were speaking. Perhaps you can elaborate or just read over the things that I put in there that might be helpful for people as well.
Sure.
But otherwise, with that, thank you so much for joining us. Certainly, I think people may also continue to have questions as time goes on too. So that parking lot document is open to our participants, and if other questions come up, encourage them to put it in the parking lot and then reach out to you to follow up.
Yeah.
So
And
for
it
the
is
rest of you, we are going to continue on with just a finish up with our HLPs. And Lindsay is not feeling well today, so y'all are stuck with me not only as your facilitator, but also as your HLP guide today. So sorry, but you get me for two things today. So with that being said, welcome to the HLP summary, I guess, for a lack of a better term today. We're just wrapping things up because we've kind of gone through all of the HLPs as an overview this year. And so what we just want to do is bring things to a close and encourage you as leaders to really just think about now that you have had a chance to get the overview, how are you gonna think about your next step and put it all together? So again, here's the graphic of all of those HLPs. What are the pillars and what are those embedded HLPs? And so our question for you is, what do you know about your staff and their needs? What do you notice about your system? What mindsets are there? What data do you have? What work is your team currently doing? And so with that being said, you can't do it all, right? And so as my former colleague used to say, you can't boil the ocean. And so what we would encourage you to do is it doesn't matter where you are in your leadership journey. We can access and build and support our system wherever you are. And so thinking about these questions, we want you to pick one pillar and start there. So just really do some reflection and be mindful of that. And then with that being said, we want you to have some mindset shifts. So starting with your leadership teams or your administrative teams or even your building teams, build that why with everyone. Be strategic, be transparent, address the culture. Make time and space for discomfort, right? So how can you create that system using those high leverage practices that serve all students with a focus on increasing outcomes for students with IEPs? Because the one thing we continue to hear as staff through induction and as coaches is, I just wish gen ed teachers would hear this, right? So, how do we create that system that serves all students, but again, focuses on increasing outcomes for students with IEPs? And so, as we think about those mindset shifts, one of the tools that we want to bring back to the forefront, which some of you may have seen in your RSN meetings or perhaps PLC meetings or other meetings, are these mindset cards. And so, a couple that we've pulled out, one is related to institutional responsibility. And here we really think about changing systems and practices. And so, what we encourage you to do, and obviously you will have access to the slides, but really think about, first of all, the questions to ask. And I'm not going to read the card to you because you have access. But certainly the questions to ask. But what I really love about this slide and when I coach teams is the sample pitfalls. And so, for example, the second bullet on this slide, you can't maintain the system as it is and improve it at the same time. So if you've picked that pillar that you want to focus on, we have to really focus in on that, right? And so instead of increasing complexity, we need to do things differently. So in other words, what are we going to let go of? What are we going to take off of our plate? What can we do differently? So that's just one of the cards that we chose to focus on. And then the other card that we chose to just bring your focus to was supporting adaptive change. Certainly, as leaders, there is a lot of technical change and a lot of technical pieces that you need to be aware of. But when we think about these HLPs, there's some adaptive change that we need to certainly bring into focus or bring into the picture. And I love the idea of expecting the unexpected, right? So technical, sometimes we can kind of go, okay, step by step, we know what should happen or what we want to happen. But when we're looking at this adaptive change, we have to expect the unexpected and that change is not linear, right? So again, there's some questions to ask. And as I pointed out on the last card, there are some common pitfalls, but also some sample practices. And again, that whole idea around bullet point one, make space and time to acknowledge the emotions because change is hard for everyone and it's going to feel differently for everyone. Um, and so looking toward the end of these bullets, assessing the organizational culture in terms of how it supports change, identifying strengths and weaknesses and systemic barriers is going to be really important as you zoom in on whatever HLP that you're really thinking about. So just an example, if you wanted to narrow the focus of the work and start with that one pillar, for example, of instruction, you would use multiple sources of data to drive it. So if we were looking at instruction, we could certainly use data sources from PCSA, EE, observation, IEP progress, student data over time. We can use teacher self-rating using the HLP screener aligned to an area. We can use PLC team data from our teams and departments or school goals. So there's just lots and lots of data sets that we can use to inform all of the different pillars. And so the question here that we would encourage you to ask yourselves and your teams is how can teams identify how those HLPs align to what is already occurring in your system? Because we always want to bring it back to that system. And then we also, of course, want to share another resource. And so again, back to those faculty guides, right? So this tool, again, using multiple tools with teams, we want to make those impactful change to the system. So this is just, again, how are we establishing those expectations? How are we designing instruction? And here are those tips for faculty to support those learning. And so then finally, we would just encourage you to take a brief moment of reflection on what is your next move. Jot some things down specific to your next steps or entry point. And I apologize, there's a typo right there. One thing you will start with, one thing you need to dig into, or one action step for your team. So I'm going to pause briefly while I switch gears, and I invite you to do some reflection before we bring us to a close this morning. If anybody's vulnerable and willing to, you can certainly drop it in the chat or unmute if you know your next move or something you want to dig into. If not, I will bring us to a close here. Let me switch gears. I just want to extend a heartfelt thank you so much for joining us this morning, and for many of you for joining us for the series. Once more, just a reminder that if you have questions for any of our speakers that you heard this morning, please add those to the parking lot. Again, I tried to capture them as they came into the chat, but we will address or route them appropriately. We ask that you please take a few minutes before you come to a close this morning to complete our end of the year survey. My colleagues will drop that in the chat, but it can also be accessed in your agenda. On behalf of RSN, DPI, and WCAST, we want to thank you again for joining us today and throughout the year. We want to remind you to register for 26-27 school year sessions, with the first one being September 16th. We wish you a wonderful afternoon, a happy summer, and we hope you get some time to relax and rejuvenate. So, unless my team has something to add, we just encourage you to take these last few minutes to give us some feedback in our survey.